Welcome to Order from Ashes, the Century Foundation's Foreign Affairs podcast. I'm Thanassis Cambanis, and today I'm joined by a group of colleagues here to talk about how the COVID-19 pandemic has affected the Middle East. We have Dina Esfandiary on the line from Switzerland.
Yep.
And Aron Lund on the line from Sweden.
Yes.
And Wahid Hanna on the line from Greater New York. Thanks all of you for joining us for today's discussion, which links to a online written roundtable that's also been published today on the Century Foundation's website. So thanks everyone for joining us. Michael, you had some really interesting thoughts about what we know and don't know about how this pandemic has played out in the region.
Yeah, I mean, I think it's a strange time even still because it is slow moving in a sense and hasn't conformed to our expectations. And so there was a moment in February when we were considering worst case scenarios. Things were starting to become quite dire in Iran. And it was a time when we knew very little about the disease and transmission of the virus. And so it was easy to think about fairly apocalyptic scenarios. Now, that hasn't come to pass, but when we first started talking about doing this roundtable, the situation in the region looked a little better. I think what we see now is transmission increasing in places like Yemen. I mean, Yemen is a place ill-equipped to deal with this. The public health sector is obviously gravely impacted by the war. And we see the situation in Egypt deteriorating. We also see an uptick in cases in Iran after transmission seemed to be decreasing. And so, as with everywhere else in the world, including the United States, it's difficult to know where this is heading at a kind of level of transmission and disease. I think we'll get into some of the more concrete effects, like the economic effects that are impacting the region as they're impacting the rest of the world. But it's extremely difficult to think beyond the kind of near term because the variables are many. And even still, our understanding of the disease and the pandemic remains pretty rudimentary. Dina, do you have any thoughts about, looking at the initial impression of Iran was quite worrisome. There was sort of lurid coverage at times in the West, almost gloating at the situation. It seemed to have stabilized, after a kind of lethargic response. But things do seem to be deteriorating again.
Yeah, that's right. As you say, Iran was hit hard pretty early on, and it was at a time where, as you mentioned, we didn't know too much about the disease. And on top of that, the Iranian government didn't quite react fast enough to it. They deliberately held back on announcing the presence of the disease because for a number of reasons, one of which was that they didn't want to scare people away from going to vote at the parliamentary elections that happened in February. So it just meant that the disease progressed much faster in Iran, and they hit huge numbers pretty early on. And it also took a while for the government to react and impose a lockdown to get things under control. Once they did, as you mentioned, things stabilized somewhat. But the problem is that they couldn't sustain the lockdown for too long. And now they've slowly started opening up. And as they've opened up, these numbers, the numbers of infected have peaked again. Now, the alternative explanation that's being offered by the government is that, of course, they have more testing kits available right now. And so it's a lot easier for them to know exactly how many people have been affected. And that may be true, but it is clear that the numbers are increasing again.
What about the impact on the elite? Because one of the early storylines out of Iran was that senior government officials, including advisors to the supreme leader, fell ill, and I think a deputy health minister died. And there was this briefly this idea that the virus was going to ravage the upper echelons of the sort of ruling structure. Did that not come to pass?
It definitely affected the elite. There's no doubt about it. And again, because it happened early on at a time where it hadn't really reached the West quite yet, or at least not as visibly. Again, it was something that the rest of the world was looking at. And there was a little bit of gloating in the West about the fact that the Iranian elite was being so affected by this disease. And then, of course, we saw that the same thing happened in the rest of the world anyway. The one impact that did have that was quite interesting was that it enabled the elite in Iran to turn around to the Iranian people and say, look, there are certain things that make it that we are just the same as you. And this came at a particularly important time. This comes at a time where a lot of the Iranian public are looking up towards the government and thinking, they're protected, they're a richer elite, they're getting on fine despite the sanctions and despite the economic struggles of the rest of the Iranian people. And the fact that the COVID-19 disease hit them so hard, the government kind of turned that into a win by really turning around and telling the Iranian public, look, we're just the same as you, and we're going to fight this in the same way that you guys are fighting it, and we're going to do this all together. And the idea was really to rally the Iranian public behind them in this.
There's an interesting parallel with Egypt here, because there was an assumption early on that Egypt was hiding cases. In that there were these positive test results for tourists returning from Egypt. And there was a sense that there was a massive outbreak happening, and that Egypt was responding in its classic authoritarian style and obfuscating. And it seems like that wasn't the real story at the time, but the attitude of the Sisi regime changed pretty markedly in March, when two senior generals died, and the sort of upper echelons of the security state were exposed to the virus. And there are some credible suggestions that quite a few more of the senior levels of the Egyptian security sector fell ill. And it's at that point when the regime starts to take this seriously. I think what's notable is that even when Egypt takes it seriously, it's not a place that went under full lockdown. It's not really clear that they have the wherewithal to impose that kind of societal closure. And it's not clear that they took advantage of that moment of social distancing to prepare themselves for what seems to be coming now. It's not as if capacity has been improved in the meantime. And I think that's a story that's going to replicate itself across the region, in that capacity is limited. Public health sectors have been neglected. And while worst case hasn't come to pass yet, it's not clear that governments have prepared properly in this seeming respite in the interim. Aron, do you have a sense of how these dynamics have played out in Syria? I mean, that when we thought about vulnerable populations and when we think about worst case scenarios, IDP camps, refugee camps, a place like Syria and other locales that have been ravaged by conflict for years. It hasn't happened in that way. Do you have a sense of where things stand?
Well, I mean, that's the thing. Syria seems like it would be at risk of a really bad epidemic outbreak, because you have, as you said, you have the country's divided into different areas that don't really coordinate with each other, and you have a lot of people who are vulnerable packed into refugee camps and IDP camps, and you have the health system is broken in places like Idlib, for example. The hospitals have been bombed. Whatever exists in form of NGOs and UN aid in the health sector has been been diminished by the pandemic because aid workers have been pulled out and the border has been shut. And funding is not available and things like that, and you've had to move funding to the COVID-19 response. And also even in the government-run areas where you do still have sort of a rudimentary state healthcare system, even there, the number of doctors who've left the country, just the brain drain and the damage and the economic crisis and the hollowed out salaries and all of this. But so far we haven't really seen major numbers in Syria. In fact, I mean the numbers put out by the Syrian Health Ministry are ridiculously low. They talk about 123 cases in total since this began, and I don't think anyone trusts those numbers. But there doesn't seem to be evidence that there is a hidden outbreak somewhere in Syria, neither in the government-run areas or in Idlib or in the northeast, where you have the U.S.-backed SDF, Syrian Democratic Forces. And why that is, I don't know. Maybe in this case, Syria's isolation actually works to its advantage, because most of the cases that the health ministry has reported is people coming from, for example, Iran by air, and they've been tested when they arrived at the airport, and they've been found to have the virus, and they've been quarantined. So maybe the isolation of Syria, the sanctions and the war and all this stuff has actually had a positive effect in this case. But then again, it could be bubbling underneath the surface, and we could have an outbreak later in the year or even in coming years, I guess.
Aron, can I ask you also about these reports that I've been seeing in recent days about people starving? One, how serious is this element of the crisis, and second, is that connected to COVID, or is that just connected to the ongoing economic Great Depression that has been going on since last fall?
Yeah, so I mean, even if the virus outbreak hasn't been severe yet, thankfully, I think the economic impact of this has been really hard on Syria, and that is not just because of the virus, because Syria was in a lot of economic trouble even before this began, and that has to do, of course, with the war, but also with the cumulative effects of crisis upon crisis upon crisis, and you've had years of sanctions and all of these things at once, and then last autumn when Lebanon. The banking crisis in Lebanon began, and the political crisis in Lebanon, which is now culminating sort of, that has spread into Syria and hit the Syrian economy big time. So you have the Syrian currency is losing value very, very fast. It was already hollowed out to a great extent before this, but now it's just sinking like a stone. And people's salaries, they don't buy food to put on the table at this point. So. And when you had when COVID-19, when that problem emerged, the regime of Bashar al-Assad reacted. They wanted a lockdown. They went in for like an authoritarian response, true to form, and try to shut down the country to the extent possible. It wasn't a full lockdown, but there was nightly curfews and things like this sort. That was late March, and then early May, Assad comes out and says that, well, this is the economy is just too bad. We can't do this. Fortunately, the virus hasn't hit us too bad, but maybe it will. But at this point, it's a choice between the virus and economic collapse, basically. And it's rare for the Syrian president or any Syrian official to be that frank about how bad the problems are. And he phrases it as, there are no preventive measures against hunger except work. We have to get people back to work. We have to get the economy going again. And I think that's where they are right now, because the economy is really bad, and it's going to get worse as well, because the Lebanese crisis is doesn't seem to be resolving itself in a positive way, at least. And also in 2 weeks, approximately, you have the U.S. Caesar sanctions, another sanctions package that comes on top of all the others, with even more stringent sanctions on the Syrian economy that will hit the economy even harder. So the economic effect of the COVID-19 crisis has been really, really bad on Syria. And I think that's something that will have political repercussions as well.
Today's world is changing faster than ever. Old rules don't apply, and the new rules haven't been written. At least not yet. I'm Rohan Advani, and I produce the Order from Ashes podcast at the Century Foundation, a leading progressive think tank that promotes peace, cooperation, and equality at home and abroad. On Order from Ashes, we try to make sense of a new international system in which America no longer dictates the global order. Join us as we talk to activists and analysts on the front lines of the most pressing issues in international policy.
So Thanassis, I mean, the place that was in economic freefall before the pandemic was Lebanon. It seems to have weathered the pandemic okay. But now this kind of death spiral in economic terms is ongoing. And it came on top of a kind of a protest, an unexpected protest movement. Do you have a sense of, how all of these dynamics that are interlinked are playing out at the moment?
So these are huge radical system shocks, and they're testing the proposition that a ruling order at some point becomes non-viable if it can't oversee like the minimal functioning of an economy or government. So and in a minute I'll parallel this to what's happening in Iraq, which is I think very similar. So in Lebanon we had these overlapping crises that you mentioned, and any reasonable hypothesis, any reasonable analysis would suggest that this just isn't viable, right? You have a corrupt, predatory ruling order. It sort of has designed the government as a way of keeping itself in power. It does not provide services. It doesn't provide for well-being. And the Ponzi scheme of the economy, which is sort of limped along since the end of the Civil War in 1991, has finally collapsed, and it's collapsing in a spectacular way that really exacerbates the inequalities in the society, and of course has been accelerated by the pandemic. The result of this is that the ultra rich are doing sometimes even better as a result of the speculation that has resulted during the collapse of the economy, and regular people cannot afford food. So like in Syria, so it's a little less dramatic in Lebanon than Syria, but it is dramatic. People for a long time now have not been able to buy meat. Now they can't buy fresh ingredients. They can't buy things they need to cook meals. Almost nobody's working. There's no economic activity. The country is not generating any wealth. It's not about a shrinking economy. It's about an economy that is simply not performing. This has wider impact in the region, especially for Syria, which relied on the Lebanese financial system to have access to banks and finance. But on a very practical level, it means that the function of society is broken, and there is an ongoing protest movement against the ruling order. And I'm fascinated. I mean, of course, my preference would be to see this terrible, rotten ruling system replaced. But just sort of analytically, I still don't see a path forward for that to happen. And it's kind of incredible as a sort of living experiment to see this kind of stress, an entire population and economy subjected to this kind of stress, and to see a ruling order that's so rapacious somehow survive fairly intact through all this. And, if at the end of this period, like if a year from now, the Lebanese ruling order has survived, I think there'll be a really fascinating explanation to have of how in the hell a government that does not deliver any of the things that we think at a minimum even authoritarian governments have to deliver to their populations can survive.
Well, and you brought up Iraq, and I mean, and I could talk about Egypt as well. I mean, no country is going through this period alone, and maybe just touch briefly on the situation in Iraq, which is also economically quite dire, particularly the collapse of oil prices. It's possible that as much as we assume that far-reaching change has to be the end result, that even these kinds of systemic shocks may not be enough to overturn these sclerotic regimes.
I mean, Iraq was rocked by a protest movement that made a real fundamental challenge to a terrible sectarian party-based power system, and the government was cracking down with incredible violence against this movement. And there was a political crisis. There was the prime minister resigned. All the parties could not agree on a successor prime minister, and this brought in geopolitics. The U.S. and Iran have to sort of come to agreement over a new prime minister and a cabinet. The different militias have to agree. So this went on for like nearly a year, this crisis. And Iraq was one of the early nations hit by COVID. I think the theory is that it came from Iran through religious pilgrim traffic. But at any rate, we've got a society that has a really terrible public health system, lots of population density. So the virus came early, and then oil prices collapsed because of this price war initiated by Saudi Arabia. And that took away the last buffer. At that point, so at a point where the country was in free fall, all the parties actually came together and managed to agree on a new prime minister, Mustafa al-Kadhimi, who has taken office. Not a transformative figure, not a reformer. He is an incremental. He seems like a decent choice in terms of competence and judgment, but he is an establishment figure, has buy-in from Iran, from the United States, from the militias, from most of the important constituencies, not from the reformers, not from the protesters. And it seems like the response to this freefall is business as usual, which I find fascinating. And I think one of the things that we also can talk about is regional dynamics involving militias, conflict, and sort of regional exchange of training and violence has continued completely unabated through the pandemic. There has not been a sort of going back to barracks of important militia groups. Or of ISIS, but by the way, which has enjoyed a resurgence during this period. So that's another interesting test, was whether this pandemic and the sort of cessation of economic activity would reduce conflict. And to date, I don't see that happening at all.
Yeah, and it's a tough problem because at some level, I think the disease is going to have its say at some point. I mean, we all hope it doesn't reach that point. But you're right that conflict and regional patterns continue, seemingly minimally affected by this pandemic. I do think, however, that there comes a point, if transmission reaches certain levels, where the status quo can't continue. We haven't reached that. I hope we don't get there. But as you say, it is fascinating how much the status quo has persevered at a kind of at the level of domestic governance and at the level of regional politics. Dina, do you have a sense? I mean, it doesn't seem as if Iran has shifted either domestically or regionally in any appreciable way in response to COVID.
No, it really hasn't. But that's pretty consistent with the way that Iran has acted over the course of the last few decades anyway. Whether it's economic fragility or, close to collapse or anything like that, Iran doesn't, continues as though it's business as usual, particularly in the region. I mean, one of the arguments that everybody had in favor of sanctions was that if we continue imposing them, Iran might withdraw from the region because it won't have the money to continue doing what it's been doing for so long. And actually, we've seen that hasn't really been the case. Now, there has been some small tactical shifts over the course of the last maybe couple of months or so. Some people have argued that actually in Iraq, they haven't been as aggressive as we saw them over the course of the past year since the coronavirus broke out in Iran, that there hasn't been any attacks against tankers anymore. But again, I think these are, I think it would be reading too much into them to think that this is a more permanent change. It seems to be a little bit of a tactical change. And it's also for a number of reasons. It's partly in response to what it's dealing with internally, because its attention is turned towards dealing with coronavirus, but also because it hasn't faced as much aggression from the US in the last 2 months as it had in the previous period or in the last year. And a lot of Iran's reactions over the course of the last year has been in direct response to a measure that the US has taken towards it. And then, of course, you have examples of Iran not changing much of its activities at all. For example, the harassment that we saw of U.S. ships in the Persian Gulf, or at least what the U.S. called harassment of its ships, where the Iranian Navy came too close to American ships in the Persian Gulf. And so you have a little bit of both. Ultimately, I don't think that the virus will have that much of an impact on what Iran does in the region, because it's essentially a different bunch of people thinking about it. And even if there is a tactical or a temporary break, once things return to normal, then Iran's just going to go back to doing what it does best in the region, which is being a nefarious actor.
Dina, I would have expected a sort of, even if it was temporary, a surge of COVID collaboration or COVID diplomacy, especially because historically Iran has had a sort of excellent healthcare and research sector, and has been has been both, substantially and also for rhetorical purposes, has positioned itself as a sort of leader of, good practice and sound, medical treatment. And they've tried to, I think, support even small scale initiatives that advertise themselves this way. So I would have expected to see, again, even if they were symbolic, Iranian led public health measures in collaboration, especially with Lebanon and Iraq, with which it already has, and Syria, with which it already has such tight relations. And correct me if I'm wrong, that just hasn't happened. Is that right? And if so, why not?
So I think the reason for that is that initially, you can't lie about it. I think the Iranian government panicked. They weren't expecting this. It happened at a time where they were very much focusing on other things. Keep in mind that this started happening at the end of January, early February. Qasem Soleimani had just been assassinated by the US. The Iranians had shot down this Ukrainian plane. They were dealing with the fallout from that. They were dealing with the spike in tension with the US. And so they just weren't expecting to deal with such a huge public health problem. And this at a time where, of course, Iran, for the better part of most of its existence as an Islamic republic, has been facing stringent sanctions, some of which have ended up targeting its public health sector, even though humanitarian and medical goods are supposed to be exempt from these sanctions. So they were afraid. They were afraid that they wouldn't be able to handle it. And at the beginning, it was tough. It wasn't clear that Iran was going to be able to handle it. They obviously, like we said, got hit hard quite early. And so they were very much focused on ensuring that they were able to beef up their public health so that they could deal with it and better manage the crisis as it went on. So I think that's one reason. Another reason is that the IRGC, the Iranian Revolutionary Guards, really wanted to be the predominant actor in dealing with the coronavirus. And so they tried to position themselves as, once again, the saviors of the Iranian nation by very publicly being the ones who came out into the streets to call on people to practice social distancing, to go home at a time where Iranians were refusing to listen to the lockdown rules. They were the ones who came out and very publicly disinfected the streets. And so for the IRGC, it was really important for them to be seen as the saviors of the Iranian nation. And that was, again, very much focused internally and not so much something that was important for them to do outside of their borders. Now, having said that, though there wasn't regional cooperation on dealing with the coronavirus with countries like Iraq and Lebanon, at least not as far as I know either, there were instances of cooperation, interestingly enough, with Iran's Gulf Arab neighbors, with who it has much higher tensions, levels of tensions at least, than with the Iraqis and the Lebanese. You saw, assistance from the Emiratis, which was quite surprising. The Kuwaitis helped out, the Omanis helped out. Even Qatar offered to transport medical aid to Iran. So that was an interesting dynamic. I don't think that it's going to lead to much ultimately, but it does show us that these countries are able to collaborate when they have to.
On a different note, I just wanted to ask Aron, is there a chance that Bashar al-Assad, having survived this much of the war, could fall as a result of the economic catastrophe that's unfolding now?
I mean, nothing is impossible, I think. I think so far, the destruction of the Syrian economy is, I wouldn't say it's worked out to the Syrian regime's advantage, but it certainly hasn't weakened the grip of the Syrian regime, because he controls the state, he controls the subsidy mechanisms, he controls, the state is a huge economic actor. His family or cronies in the business landscape have they control the rest of the economy basically. But you do have a situation now where the pie is shrinking, and this is probably related to the trouble we're now seeing inside the top echelons of the Syrian elite, where his cousin Rami Makhlouf, who was always the top businessman throughout the Bashar al-Assad era since the late 90s, early 2000s, he's now in open dissent, basically, in open sort of a Facebook insurrection against his cousin, the president, and posting videos on his private Facebook account where he says, they're trying to steal my company, they're trying to force me to pay taxes that I shouldn't have to pay, and there's oppression, and there's a police state in Syria, he suddenly discovers. And what that's about is not clear, but it seems like the regime led by Bashar has decided that they want Rami Makhlouf to pay more money. They need the money. So it might be a case of the regime cannibalizing itself, but it might also be that Bashar is sort of reconfiguring the inner circle networks, and he wants to shift the power that Rami Makhlouf and the Makhlouf family, which is, Bashar's mother's family, that they had, and sort of tries to shift that to other loyalists. So it's all very there's no transparency. There's a lot of rumors going on, a lot of disinformation from all sides. But there is something happening in a very sensitive area of the Syrian elite, and in ways that we really haven't seen for 20 years, 30, 40 years even.
There's an interesting parallel with Egypt, in the sense that, for a variety of reasons, there was some reshuffling within the security sector following protests in the fall. It remains opaque what all the internal struggles were about. We know that they existed. And yet, faced with these systemic shocks, there has been no course correction in Egypt. The Sisi regime hasn't released many political prisoners. It continues to arrest new ones. There are consistent fears about what outbreaks in Egypt's prisons would look like. These are places of mass overcrowding. Simply no way to protect those populations, and of course could become a vector for transmission outside. And yet, in the face of all this, the Sisi regime remains outwardly consistent in the way that it treats governance and the way it treats its population. And then again, it comes back to this point you raised earlier, Thanassis, about the kind of perseverance of the governance status quo, as poor as it is. And of course, I wonder because this is a kind of shared experience of kind of region-wide, kind of global misery, that it doesn't have the kind of same sense of specific treatment for any of these populations. I mean, it's something that all of these countries are undergoing at the same time. And I just psychologically, I wonder what that does to politics and the sense that this could lead to anything new.
Michael, I think that's true for Syria as well. That even under all this stress, the Syrian regime hasn't really changed its behavior. It might grow weaker. There might be internal fissures. We don't know. But there is I cannot see any sort of shift in the rhetoric or the focus they have on retaking territory from Idlib. There's been no prisoner releases or anything of that sort. So, the regime might grow more predatory, it might grow weaker, it might grow more corrupt, it might have trouble controlling territory the way it has in the past few years. There might be internal problems, but there doesn't seem to be any new will to compromise or any new sense of, that this is a new, they should respond to this differently than they have to any other crisis. And the response so far has just been to dig down and fight to keep whatever they can keep.
Yeah, you can almost say the same thing actually for Iran. The government has been under severe stress, and it has been for a while. Actually, it's not just since the outbreak of the coronavirus, but not much has changed, and it's not like they've shown that much a will to compromise either. What they have done is that they've tried to turn this into as much of a win as possible by stoking nationalism and by highlighting what I mentioned earlier, which is that ultimately the elite and the people are the same. The disease doesn't know the difference between the two, and it affects everybody. And as such, the country needs to unite in order to fight it. And they've really been pushing that the nationalism line over the last couple of months, and really pushing that line of unity. And you also see that with a lot of the placards and stuff that they've put up throughout the country. I don't know if that's going to work in the long term. It's certainly people are certainly too busy right now to worry about that kind of stuff. But one other thing that the crisis has done is that it's made Iranians even more brutally aware of the incompetence of their government. I mean, these were things that the Iranians had seen way before the outbreak of the virus, and the most latest iteration of it was the shooting down of the Ukrainian plane in January. But the way that the government handled the outbreak of the virus was just another very, very public show of incompetence. And so Iranians are incredibly aware of that right now. And we have to think about the political timeline in the next little while. And we're slowly coming up to the elections, the presidential elections next year. And after a largely conservative takeover of parliament in February, it'll be interesting to see which direction things go with the elections.
And, from a global perspective, incompetence has been rife, starting, right here in the United States, which, poses some other interesting questions. One of them being if most of the powerful governments, or most of a lot of powerful governments have been equally inept, does that end up actually paradoxically reducing the cost of incompetence politically? And I do wonder, as a person with a historian's background, whether the potential for transformation as a result of this crisis is going to be on a different timetable than the one we're used to. So if there's going to be some kind of major shift in response to these failures, it's not going to be one election that unseats a ruling order in Iran or in the United States, but rather a decade-long shift back to embracing, let's say, science and competence in the delivery of public goods like public health. I'm not optimistic, I think is clear from from everything I've said, that's the likely result. But if there's going to be a good result, I expect it's going to unfold really slowly. And I have been surprised by how little there has been a tangible impact of these shocks, from things like the killing of Soleimani to the inept health response. And I'm not just talking about in Iran, I'm talking about in Washington. Those are crazy moves in the United States that have not yet had a noticeable impact. And 5 years from now, either we'll trace our terminal decline to this long period, or if in the best case scenario, we see some kind of revival of human fortunes, we'll maybe say this was the bottom, where across the world people decided to reinvest in basic competence and transparency in things like building their public health systems.
Yeah, I mean, just to close, I think, what you hint at is that just the sheer multiplicity of variables. I mean, this is not the status quo in terms of what is going on a kind of global scale. We have a national political crisis here in the United States. We have elections in November that, are going to have, a massive impact in terms of America's domestic governance, but also America's role in the region and the world. And I think it will be interesting, to look back on this period, because, we're very early in this pandemic, potentially. I mean, we, judging by reactions in many places, it seems as if we've sort of decided that it's over. And obviously it very well might not be. It's hard to think too far into the future in the face of all of this instability, and yet we should hold out the possibility that despite this turmoil, we aren't going to see far-reaching change, and so I think it's good to have perspective that this is still quite early in this period.
Thank you all for joining us for the podcast. You've been listening to Order from Ashes, the Century Foundation's International Affairs podcast. I'm Thanassis Cambanis in New York, and I've been joined today by Dina Esfandiary, Aron Lund, and Wahid Hanna. Thank you all so much for coming on the show.
Thanks for having us.
Thanks, Thanassis.
Thanks for having me.
You've been listening to Order from Ashes, the International Affairs podcast from the Century Foundation. If you enjoy what you heard, please rate us and leave a review wherever you get your podcasts. It'll make it easier for other listeners to find us and help us keep producing these conversations. Thanks for listening. See you next time.